This is the Patient Assessment Management medical skill. In this skill, you will have 15 minutes to perform your assessment, patient interview, and voice treat all conditions discovered. You should conduct your assessment as you would in the field, including communicating with your simulated patient. You may remove the simulated patient's clothing down to his or her shorts or swimsuit if you feel it is necessary. As you progress through this skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example, blood pressure, should be obtained from the simulated patient just as you would in the out-of-hospital setting. You may assume you have 2 partners working with you who are trained to your level of care. They can only perform the interventions you indicate necessary, and I will acknowledge all interventions you order. I may also supply additional information and ask questions for clarification purposes. Do you have any questions?
No questions.
Your dispatch information is here. EMS Unit 23, respond to 321 Congress Street, the Ram Restaurant. You have a 49-year-old male complaining of chest discomfort. Timeout is 17:35. You and your partner arrive at 17:40. You approach the patient and notice a moderately crowded dining room with several people around one particular table. There does not seem to be any hazards to your safety. You determine that there is only one patient. Upon arrival at the table, you introduce your partner and yourself to the patient, who gives his name as Paul Antak. The patient is sitting in a chair at a table clutching his chest. You note that he looks very anxious.
Okay, first I'm going to make sure that my scene is safe and that I have on appropriate PPE. I'm then going to approach and determine that I have one patient, and it seems that the nature of illness is some type of a chest pain that he's complaining of, and I am not going to hold C-spine at this time. As I approach, I'll begin to give my general impression. Okay, so my general impression is that I have a 46-year-old male patient. He appears conscious and alert, sitting at the dinner table, and he's holding his chest. So I'm going to approach the patient, introduce myself. Hi, sir, my name is Tana, and I'm with the local ambulance company. I understand that you're not feeling well today.
I feel like someone is standing on my chest.
Okay, the patient appears to be alert and oriented, and his chief complaint is that he's having some type of chest pain. I'm going to evaluate airway. It appears open and clear because he's not having any difficulty talking to me, and I want to assess breathing, and at the same time I'm also going to check a pulse rate. Okay, I was able to obtain a pulse rate of 86 beats per minute and a respiratory rate of 16 per minute.
The patient's pulse is 98 beats per minute. The patient's respiratory rate is 28 breaths per minute.
So the respiratory rate is 28 per minute. Is he having any difficulty breathing? Am I noting any noisy breathing, labored breathing, or is it good quality?
It's good quality.
And what about the regularity?
It's regular.
Okay, I'd also like to get an SpO2 reading if I could.
91% on room air.
Okay, because I'm considering this is a cardiac patient, but his SATs are less than 94%, I'd like to have my partner put my patient on nasal cannula, and let's start at 2 liters per minute. And is he tolerating that nasal cannula?
Yes.
Okay, so now I will move on to circulation. You said my patient has a pulse rate of 98 beats per minute, and what is the quality?
It's strong.
And the regularity?
Irregular.
It is irregular. Okay, I'm going to also note the skin appearance in the conjunctiva, in the nail beds, in the gums. Am I noticing any signs of cyanosis?
No, it's pale.
Okay, and what about the color temperature?
It's cool and moist.
Okay, so I am noticing that there is some moisture on the skin, so that's indicative of shock. I'm also going to take a quick look at what I can see. Do I see any major bleeding that I need to be concerned about?
No.
Okay, so given his presentation, this is a priority patient. I would like to transport as soon as transport is available. I'm going to currently leave him on 2 liters per minute via nasal cannula. We will transport in a position of comfort, and I'll make sure that I avoid any excessive heat loss by putting a blanket on him. So Mr. Antak, I'd like to ask you some questions specifically about that chest pain that you're experiencing. So when this came on, did it come on all of a sudden, or did it come on very gradual?
It began very suddenly.
Okay, and have you done anything that has made it worse, or have you noticed anything that's made it worse?
Nothing has made it worse.
Have you done anything that's made it feel better?
Nothing has made it feel better either.
Is the pain been somewhat constant then since it came on, or has it been intermittent?
At first I thought it was just indigestion, but it didn't go away. It feels like a dull squeezing pain that is also in my left arm.
Okay, so as far as quality, you would say that this is a dull type of ache. And then it travels down your left arm. Is it also in your chest as well as your arm, or has it moved?
It's in my chest and traveled down my left arm.
Okay. On a 1 to 10 scale, where 1 is you don't notice any pain at all, and 10 is the most severe, where would you say your chest pain is right now?
This is pretty bad. It's an 8.
An 8 out of 10, okay. And when did this all start?
About 20 minutes ago.
Okay. Do you currently have any allergies to medications?
Not that I know of.
Okay. And what about any medications that you're currently taking, both prescribed and over the counter?
I take medication for high blood pressure, and my doctor gave me these nitroglycerin tablets to take in case of severe chest discomfort, but I haven't taken any.
Okay. So those are your nitroglycerin tablets that the doctors prescribe, but you've not taken any today?
No, I've not taken any ever.
Okay. And are you on any other medications?
No.
Okay. And has this happened to you before, this type of chest pain?
No.
Okay. So the doctor gave you the nitro because you've experienced chest pain in the past?
No, I have high blood pressure, and he thought it might happen.
Okay. So when was the last time you had anything to eat or drink?
I was eating when the pain started.
Okay. And so as far as events, what you were doing, you were eating. This all came on about 20 minutes ago or so. It came on very suddenly, and you're feeling a very tight, dull ache in your chest that's traveling down your arm.
Yes.
Okay. So now I want to do a quick physical assessment of the patient. I'm going to once again recheck the skin just to see if there have been any changes. And previous, the skin was cool and the skin was moist. So it's pale and it's cool and it's moist. I'm also going to look for just any signs of injury in and around the head. Do I see any?
Nothing noted.
Okay, I am going to check the patient's pupils to see if they're equal and if they are reacting appropriately to light.
They are, but they are slightly sluggish.
Okay. So I'm going to look at the patient's neck for any jugular vein distension. I'm also going to look for tracheal deviation.
Nothing noted.
Okay, and I want to evaluate the patient's chest. Do I feel any crepitus? Do I feel any subcutaneous emphysema?
No.
Okay. I also want to get a set of lung sounds on the patient. I can do at least 2 sets, and I can check anterior, and I can do bilateral axillary.
They are equal and clear bilaterally.
Okay, and I could also do posterior if I had the ability. So lung sounds are good. I'm also going to check the abdomen to see if there's any distension, any tenderness noted.
Nothing noted.
Okay, and a quick count just down the extremities to see if I see any swelling, any injury, and if I have good pulse and movement and capillary refill.
Pulses are present in all extremities. There is no edema.
Okay, so there's no swelling in the extremities and the patient looks to have good perfusion in the extremities. So now I want to go back and revisit the vitals. I have a respiration rate of 28, a pulse rate of 98. What is my current saturation of oxygen?
95% while on the 2 liters.
2 liters per minute nasal cannula, and the patient is still tolerating it. The pupils are sluggish and the skin is pale and moist and clammy and cool to the touch. So I do need to get a blood pressure on this patient. And I got 158 over 82.
The patient's blood pressure is 180 over 110.
180 over 110. Okay, so based on my history and the vitals and the physical assessment of this patient, I feel, or my field impression, that he is having some type of a cardiac event. This could be related to angina, or this could actually be a heart attack or a myocardial infarction. I would like to continue on the 2 liters per minute via nasal cannula. I'll continue to make sure I maintain good body heat and that he's in a position of comfort. For medication, because his physician has prescribed to him nitroglycerin, and I verified his blood pressure was over 100 systolic, his heart rate is less than 100 beats per minute, and he is not currently taking any other vasodilators. I can give him 0.4 milligram or 1 of his nitroglycerin tablets. I'll make sure that it is his medication, that it has not yet expired. I'll want to make sure I verify the dose, 0.4 milligram, and that it is given sublingual or under the tongue. I'll also, because he didn't indicate he's currently taking any other anticoagulants and he is not allergic, give him 2 aspirin, 81 milligram, low dose to chew. And if my protocol allow, I would like to also give 2 81 milligram tablets to swallow as well, for a total of 324 milligrams of aspirin. And then I will recheck his mental status, ABC, and his vitals 2 minutes after medication delivery. Then I will continue to reassess the patient, and I will reassess mental status, airway, breathing, circulation. I will reassess the vitals, and I will reassess my current interventions every 5 minutes, because this is a critical patient, as I go en route. The report that I would like to give to the hospital is that I have a 49-year-old male patient complaining of chest pain that he states came on suddenly, approximately 30 minutes ago. He is alert and he is oriented. His current respiration rate is 28, pulse rate 98, blood pressure 180 over 110, and he has a saturation of oxygen at 95% on 2 liters per minute via nasal cannula. His pupils are sluggish. There was nothing noteworthy about the physical assessment of the patient. He does have a history of angina, and I have given him 1 of his 0.4 milligram nitro tablets sublingual approximately 5 minutes ago, along with 2 chewable 81 milligram tablets to chew and 2 to swallow, for a total of 324 milligrams of aspirin. We will be to your facility in approximately 5 minutes. Do you have any questions?
No.
I'm done with this station.